My name is Jim Zins, and I can tell you I've been doing facial aesthetic surgery for a long time. A gentleman doesn't divulge his age, but I have been doing this for a long time, and I'd like to speak with you about a topic which I have a passion for. It's my profession, but it's also my avocation. So what I'd like to talk with you about for the next 20 minutes is a couple of pearls on how to look better and maybe even look younger. So principle number one is the face ages in a global fashion. So the face ages in its entirety. It doesn't just age in the eyelid area or the cheek area or the neck area, but the entire face ages in a global fashion. And therefore, the best treatment really is treating the face globally, not just treating it in a single area. Now let's just look at this resemblance, this mother and daughter photograph. Clearly we can recognize the semblance, but look what's happened with age. With age, that very attractive oval face of youth has been now changed to a more masculine or square face in the lower face. And look what's happened in the eyelid area. The eyelids have skeletonized as the cheek has descended in the lower face, and the lower face, the jowls have masculinized the lower face. If we look at, again, we can show this pictorially. Again, look at the eyelid and the cheek, how it really is one in youth, but as the patient ages, the cheek descends and the eyelid becomes separate from the cheek area. The fold from the nose to the corner of the mouth lengthens, and the jowls form, making the face look more masculine or square. So therefore, the best approach, because it's a global phenomenon, is to treat the face in a global fashion. Now, this is the best approach, but not necessarily the only approach. But let's look at a few patients and we can see the very nice changes that we can bring upon, making the patient look better and perhaps even look younger. So this is a before and after picture at 1 year on a patient who first we treated with skin care to improve the appearance of the skin, to correct the mottly browns and whites in the skin, blend the skin. And then after that was done, we did a face and neck lift and an eyelid blepharoplasty. And you can see the very nice change she's had in the front view and the very nice change she's had in the profile view. And also, I just bring to your attention the change in the pigment of the skin, how much nicer the skin looks because of the skincare regimen. The quality of the skin is improved in addition to improving the overall face.
Wow.
And if we look at another patient, again, before and after, the patient looks rested, looks more relaxed, and perhaps even younger after having a face and brow lift surgery, facelift, neck lift, and brow lift surgery. If we look at this patient, you can see the very dramatic change that she's had around the mouth. In addition to a facelift, she had a chemical peel where we treated the wrinkles around the mouth area. Now this requires a deeper chemical peel than you get from the esthetician because these wrinkles are so deep. And this was done at the same time that we did her facelift surgery. So what happens with age? Why do we age and what can we do about it? Well, we think about this as intrinsic and extrinsic problems. Intrinsic problems are those problems which arise because of your heredity, your skin thickness, your facial bone architecture. Much of this you inherit from your mother and father. And I'm going to give you some example. So those are things we have no control over. The extrinsic problems with aging, those are smoking and significant variations in weight. Those things are very, very detrimental to your aging, in addition to actinic changes or changes you get from sun, wind, weather. So those are extrinsic changes which you can control. Now, when we look at the face, we can look at it from a subjective standpoint, but actually as plastic surgeons, what we do is we actually have numeric facial proportions which we can observe and correct and make the patient look better. Now, after this lecture, you're going to be able to actually do this on your own, because many of these facial proportion concepts are very, very simple. So if we look at the distance A, that is the distance from the brow to the corner of the eye, that distance A should roughly be the same distance as the distance of the upper lip, and that is the distance from the nose to the corner of the mouth. Similarly, that distance C, that distance of the upper lip, should roughly in the vertical dimension be approximately 1/2 of the distance of the vertical distance of the chin, or from the corner of the mouth to the chin area. And when these distances vary, then patients look less than ideal, less attractive. Similarly, if we look at the transverse dimension, that is the dimensions horizontally from side to side, the distance from the cheekbones here should roughly be the same as what we call the bigonial distance, or the distance along the jawline. And that should be roughly equal to the distance in the temple region. And then if we look at the profile area, here's a line which is very, very easy to decipher. If we just draw a tangent, that is a tangent from the upper lip to the lower lip, the ideal chin should fall on that line. When the chin falls behind this line, the patient has a weak chin. When that chin falls in front of that line, the chin is too prominent, both of which can be changed with relatively small surgical procedures. When the facial proportions are not ideal, surgical correction can have a very, very significant effect. And let me just show you a couple of examples. So again, we've looked at those distances. If we look at the distance from the brow to the corner of the eye, it's relatively short in this preoperative view. And look what happens when we open up that eye and we correct that distance. So the distance from the brow to the corner of the eye is roughly the same as the distance from the base of the nose to the corner of the mouth. Look how much that improves the appearance of her eyes. And if we look at another patient, this patient, if we look at the transverse dimension, we've talked about the distance from the temples should be roughly equal to the transverse distance of the jaw. Now look what happens when that's abnormal. Look how abnormal that patient looks. With a relatively straightforward operation, we contoured the jawline, and you can see how we've made that patient look so much more feminine. We also lengthened the chin. If we look at the distance from the nose to the corner of the mouth, we said that's roughly half the distance from the mouth to the corner of the chin. It's about 1-to-1 here. But look what happens when we lengthen that distance, how much more attractive that patient looks. Here, we did a 45-minute operation on this patient ventriloquist who was planning on getting married. She came in, she didn't like the position of her chin in the vertical dimension or in the horizontal dimension. Again, upper lip roughly equal to the distance of the chin. Look what happens when we vertically lengthen that chin in a 45-minute operation. You can see the very dramatic improvement that she has. Again, that line from the upper lip to the lower lip, that tangent now falls on that line. And look what a decided improvement that 45-minute operation has done. We can put that together in this facelift patient, and you can see we've done a facelift, but we've also vertically lengthened the chin to significantly improve the overall appearance. So facelift and a chin advancement to decidedly improve the result of her surgical procedure. Now, that's a fair amount of surgery, a facelift. You know, that's an operation that requires general anesthesia, requires a recovery of really a couple of weeks, and many patients don't have the time or don't want to undergo such an involved procedure. But there is a subset operation where we can achieve a very significant improvement in the jawline with a much more simple operation. If we look at this patient here, this patient didn't have a facelift. This patient had an operation limited to a small incision under her chin, and we liposuctioned the chin area and we put in a small chin implant. And you can see the very decided improvement she had, again, with a 45-minute operation. Now, We can extend this procedure, and this is an operation which I've championed over the years. Here is a patient before and after. Some may think she had a facelift, but no, she didn't have a facelift. She had an operation that we limited to just an incision under the chin. We liposuctioned the neck area, and then we just tightened the muscle in the neck area. And you can see the very decided improvement that she's had, especially in her profile view. So again, an operation that is much simpler, much less recovery, much less costly, but with a very significant operation. Again, no incision in front of the ear, no incision behind the ear, just a small incision and a 45-minute operation to correct the neckline. Here's another patient. This is actually a patient, it's actually a friend of mine whose daughter was getting married in about a month, 6 weeks. She really didn't have the time to have a facelift, but she was hoping to look better at the time of her daughter's wedding. So what we did was we did this limited operation by making a small incision under the chin and taking out the fat in the chin area and tightening the muscle. Again, not much change in the front view, but a very decided improvement in her profile, in the neckline and in the jawline. So you can see the very nice improvement that we can get with a relatively straightforward operation. Again, facial aging affects the entire face. It's not just, doesn't just affect the eyelids or the chin or the neck. It affects the entire face. However, many patients come in and they are concerned about one specific anatomic area. Then that area certainly can be addressed. And the eyelid is a very, very common area for patients to come. They come in complaining of changes, aging around their eyelids. They really are not concerned about aging around the rest of the face. So here is a patient with a significant lower lid problem, lower lid laxity. You actually see the whites of his eyes in the lower lid area, and you see the lower lid bags. So this was an operation. This is a lower lid blepharoplasty, which requires a small incision under the eyelid area, the removal of fat in the lower lid area or repositioning of that fat, and then tightening of the lid. Again, a very, very minor procedure that gives you a very, very significant improvement. He looks less tired. He looks less angry. Maybe he even looks younger. Another patient who presents with what we call congenital bags. That is baggy lower eyelids, which she had her entire life. This wasn't just because of facial aging. This patient was treated with an operation where we just made an incision inside the eyelid area, so there's no incision made on the outside at all. And you can see the very nice improvement that she's had in the lower lid area. Another patient, this is a different problem. This is not a problem of extra skin in the upper lid. This is a problem of the muscle in the upper eyelid is not functioning properly, and she has what's called upper eyelid ptosis. So what we can do, again, with an operation that lasts about 45 minutes under local anesthesia with sedation, we can open those eyelids by tightening that muscle and make that patient look much, much more awake and alert. So this patient doesn't require upper lid blepharoplasty surgery, but really upper lid muscle tightening in addition to the blepharoplasty. You can see the very nice improvement. Also, I'll point out to you that how the upper lid show is consistent across that whole lid, making that upper eyelid look so much more attractive. Before and after, again, tightening that upper eyelid and making that upper eyelid look so much more attractive and the patient looking so much more wide awake. This patient has a lot going on in the periorbital area. She's got sleepy eyes because the upper eyelid muscle's not working properly. She's raising her eyebrow to try to correct that upper eyelid ptosis, and she has a very significant aging in the lower lid. So we did an upper lid blepharoplasty, we tightened the lower lid, and we did a lower lid blepharoplasty to get this kind of correction. Again, all these procedures require surgery, requires some downtime, these various procedures, some requiring a little bit more downtime than others. Now there are things that we can do in the office that don't require downtime. And then we're talking about things such as fillers and Botox. Now, fillers fill, fillers do not lift. That's a common misconception. So what we do is with facial aging, patients at least have the perception, if not the reality, of losing volume in their face. So what we do is we add volume. I mean, who has no wrinkles? Fat people, right? So what we're doing is we're adding volume to the face to take away some of the appearance of deflation or loss of facial volume or loss of weight. And these fillers, there are a wide variety of fillers. The very most common ones are the hyaluronic acids. That's the Restylans, the Juvederms, the Volumas, etc. And the reason that these are so popular are because they are reversible. Should there be any type of problem, patient is dissatisfied with the filler, these are reversible. So that is one of the reasons they're so very, very popular. Again, hyaluronic acids, Restylane, Juvederm, Voluma. Radiesse is a more long-lasting filler, so that is desired by some patients. The problem is with Radiesse, things are not reversible. And then Sculptra, yet another prototype developed initially to treat patients with HIV, lipoatrophy, or AIDS, to, again, add volume to the face with longer lasting results. Now, when we talk about fillers, the paradigm is very different from surgery. And what do I mean? When we do a surgical procedure, the patient is told what the cost of the procedure is going to be, and then we take the time and effort to do whatever it does to deliver the best result. Fillers, on the other hand, is a bit different. Fillers, the patient has to pay by how many syringes, how much volume we use. So if we use one syringe, it's one price. If we use a second syringe, obviously it's more costly. So what do patients do? They come in, I want to treat my eyebrows, I want to treat my lower lids, I want to treat the down corner of the mouth, and I want to use one syringe. Well, it doesn't work that way. We need to use enough of the product to get the best result. So what occasionally can happen is that in an attempt to save money by the patient or the doctor, the patient is undertreated, and therefore they say the product didn't work. Well, it wasn't that the product didn't work, it was that not enough product was used to get the optimal result. On the other hand, it is perhaps best, obviously we want to treat and get the ideal result, but probably undertreating is better than overtreating because we can always come back and do a little bit more. It's much harder to remove that filler than it is to add a little bit more. So ideally, we'll look for the optimal result, but probably undertreatment is better than overtreatment. So is longer better? The hyaluronic acids, for example, they're relatively shorter lived than products such as Radiesse or Sculptra. But when it lasts longer, it can be good. But when it lasts longer, it can be bad, especially if there's an adverse effect. If you get a lump, irregularity, etc., then in the longer lasting products, that lump is going to be there for a longer period of time. So here are a couple of slides on how we actually do the fillers in the office. What I like to do is I like to use this eyeliner pencil. I mark the areas that I'm going to treat, and then I show the patient in a mirror, here are the areas that you and I decided we're going to treat. So in this patient, the folds were deep, and she had what we call marionette lines, or she had jowls in the lower face. So we're going to treat what we call the nasolabial folds, a line from the nose to the corner of the mouth, and then we're going to treat the lower face as well. So we mark that with the eyeliner pencil, and then what I like to do is I like to treat one side of the face and then allow the patient to sit up, take a look in the mirror, and then they can compare the side that's treated to the side that's untreated, and that they can see the difference, and they can participate in the decision. Well, oh, it looks better, but I'd like a little bit more volume. I'd like a little bit more effacement of the wrinkles. Okay, then we can do a little bit more filler. Or, you know what? That looks ideal, and let's stop right there. This is especially true in the lip area where many patients want just a subtle change in the lip and they don't want the lips overdone. So we can do the lips, we can have the patient sit up, they can take a look and say, okay, that's enough, or you know what, that's better, but I'd like to see my lips a little bit bigger. The areas that I most commonly treat with fillers are the nasolabial folds, that's the folds from the nose to the mouth, the lips, the marionette lines, or the so-called puppet lines, or the lines just in front of the jowls, the corners of the mouth, and the tear trough is that skeletonized area under the lower lids, which I showed you at the beginning of the talk. So nasolabial fold from the nose to the corner of the mouth, these are really easy areas to treat. And the ideal candidates are those patients who, like everything else, the younger, the easier they are to treat because the skin is elastic. There's not a lot of skin to fill. So the ideal patient is a patient with relatively tight skin. The more difficult patients are those patients with very deep fold and have true skin excess. And I'm going to show you examples of both. So here's a before and after. This patient had 2 cc's or 2 syringes of hyaluronic acid to treat the nasolabial folds, the lines from the nose to the corner of the mouth, and this is approximately 6 months later. And here's another patient treated with 1 cc on either side, treating the lines from the nose to the corner of the mouth, softening the corners of the mouth. And finally, another patient, nose to the corner of the mouth, and another patient, again, softening those lines, nose to the corner of the mouth with 1 cc on each side of hyaluronic acid. The next patient, this is a patient, you can see that the folds from the nose to the corner of the mouth are significantly improved. But this 70-plus-year-old patient, for me to correct these with filler would take a gallon of filler because the skin is so loose and he really has true skin excess. So instead of filler, what we did was we did a direct excision or cut out the skin between the nose and the corner of the mouth, and you can't even see the scar because that scar is so well hidden within the fold. So again, a procedure that's done under local anesthesia with approximately 5 or 6 day recovery, very simple and a very significant improvement. We treated this patient with a direct excision of the skin to achieve this result rather than using filler. The tear trough area, or that area of skeletonized in the lower lid, that's the difficult area to treat, and that's got to be treated judiciously by someone who's fairly experienced. We treat that area, again, local anesthesia. I use a blunt catheter that minimizes the pain. I use local anesthetic with epinephrine in it to minimize the bruising, and again, office procedure to camouflage that skeletonization of the lower lids. And you can see this before and after picture. This area requires very, very little filler. So this was just a 0.5 cc of filler on each side to correct this area. And here's another patient. Again, age has skeletonized the lower lids. So we've gone ahead and we put filler in the lower lids using a 0.5 cc on each side to correct the hollowness or skeletonization of the lower lid region. Lips are tricky. Lips are also another more difficult area. The easiest patients to treat to fill their lips are patients who have substantial amount of lip to start with. And I'll show you a couple of examples. And then the patients with very, very thin lips, they're more difficult to treat. So here's an example of 1 cc of filler in the upper lip. If we're going to treat the upper lips, we will treat the lower lips because the upper lip really should be smaller than the lower lip. So once the upper lip is treated, we also treat the lower lip. So you can see the improvement that this patient had with a very small amount of filler in the lip region. And then finally, Sculptra. Sculptra, as I've mentioned to you, this was developed initially treated patients with HIV, what's called lipoatrophy, where they lose volume in their face, they lose soft tissue fat. And I got a lot of experience in treating those patients. Then this became approved for facial aging. And now we can use this very akin to fat grafting. So here is Sculptra. It comes as a powder. We reconstitute that with a local anesthetic, and then that's injected into the face, and it actually stimulates fibrosis and wound healing, and it adds volume to the face. So you can see this patient with hollow cheeks was corrected with 2 sessions of filler using L-polylactic acid or Sculptra. Again, fillers augment facial volume. Fillers fill. They can correct contour irregularities. They soften aging lines. They cannot lift. They can give the appearance of lifting, but they cannot truly lift. Complications, nothing we do is free of problems. Fillers are relatively free of problems, but there can be problems with fillers. Those problems can be addressed with hyaluronidase. That is an enzyme which dissolves the hyaluronic acid. So again, that's one of the main reasons that we favor the use of hyaluronic acids as opposed to the other fillers. If you can see here, again, wait, don't tell me, something must be different. It's a pleasure talking with you. I'd be glad to answer any questions, and it's really been a lot of fun.
One question we have is, how do I maintain dermal fillers? Is there anything I can do to make them last longer?
Longer lasting fillers can be good and they can be bad. So one thing is the choice of filler will dictate to some degree how long the filler lasts. The more cross-linked the hyaluronic acid, the longer it tends to last. Hyaluronic acids work, we inject them, but they absorb water very avidly. So as they're absorbing water, that's how they maintain their volume over time. One way to maintain that filler, I like to see the patients back in 4 to 5 months. And if I see you back in 4 to 5 months and you have a little bit of loss of filler, just a small booster at that time, I can generally get the filler to last for a year to a year and a half. So the best way to maintain that filler appearance is to return to see me or to see your doctor rather than when it's all gone in 4 to 5 months when there's only been a small amount of loss. Then a small booster can lead to long-term maintenance.
How old is too old for a facelift?
That's also a wonderful question, and I have to refer you to the article which I wrote on this topic about 2 or 3 years ago, when what we did was I took my last 215 facelifts and we divided those patients into what we considered the older age patients. Those were patients who were over 65 years of age, and we took the younger age patients who were less than 65 years of age. And then we looked at problems, which is what you're asking me. When do the problems become so apparent that it's inadvisable to do the surgery? When we looked at those two groups of patients, the older age group and the younger age group patients, there was no increased incidence of problems in the patients over 65 years of age, minor problems or major problems, compared to the younger patients, less than 65 years of age. But what does that mean? That presupposes good screening. So when you come into the office, we do a good history to make certain that there are not significant predisposing factors that would make surgery inadvisable. So what do I mean? Well, if there was significant heart disease, significant lung disease, something that's going to make it more likely for you to have a problem. I actually saw a patient last week, very anxious, an older patient of mine, I'd done surgery before, who wanted to have a facelift, but her medical history precluded that. So I had to say, although you're a candidate, you have the signs of facial aging, this is not an operation for you. It's really too risky. We certainly don't want to take a chance with elective surgery if your health is in question. So those patients would have to be turned down. So therefore, although those patients over 65 had no higher instances of problems, it was because they were pre-screened. Now, other specialties don't have the luxury of doing that. I mean, if you need bypass surgery, we can't turn you down just because you're not terribly healthy, or you have a cancer, you still have to have the surgery. We have the luxury of being able to pre-select our patients, unlike many other surgical subspecialties. Therefore, physiologic age is more important than chronologic age. So your actual age is not as important as your health, basically, is what I'm saying. So we operate on patients who are 65 years of age for facelift. We operate on patients who are 70, 75, and I've even operated on a patient who is 90 years of age to have a facelift because these patients were in good health.
Wow, thank you. That also answers the question of who isn't eligible for a facelift. So thank you for that. And then the last question that I see right now is, how long will a facelift last?
Well, again, these are all wonderful questions. These are great questions. How long a facelift will last is individualized depending on many of those factors which I talked to you about before, the intrinsic factors and the extrinsic factors. Intrinsic factors, we're talking about your bony structure. Those patients who tend to have weak chins, that if the skeleton, it doesn't support the soft tissue well, then those patients tend to age a little bit prematurely. So conversely, those patients with good bone structure, with the chin is in ideal position, the cheekbones are strong, those patients are going to age better and their facelift is going to last longer. Conversely, that patient who has had a lot of sun damage, has got a lot of extra skin, that patient who has lost a huge amount of weight, we're talking about 100 pounds, those patients, their facelift is not going to last as long as patients who are younger, whose skin is more elastic, who haven't had the amount of sun damage that they have and have a good bone structure. So again, it's very, very variable. But if you were going to globally ask me, what do I see? What do I see about my patients coming back? You know, I've been doing this long enough that patients come back for a second facelift very, very commonly. Generally, patients are coming back to see me in about 10 years. The neck has held up very, very well during that 10-year period, and the amount of work I need to do on the neck in a secondary facelift is relatively little. The cheeks and the nasolabial folds, the cheeks have descended more. So really what we can do is you can limit that surgery just to the cheek area and really do little or nothing in the neck area at that 10-year interval. But by and large, I'm finding the patients are, the facelift is lasting about 10 years.
Well, that seems to be all of our questions that we have for the evening. Again, thank you so much, Dr. Zins,
My
for
pleasure.
being innovative and interacting with your patients in this way.
My pleasure.
We appreciate it, and we hope you enjoyed the evening. All right, have a great night.